Here's a painful conversation for you. We all experience pain in one form or another, physical, mental, and sometimes chronic. But unrelieved pain is a major issue. 1 in 5 of all Australians live with chronic pain, and 1 in 3 Aussies over 65 deal with it daily. And its cost to the Australian economy is estimated at around $34.3 billion a year. Up to 80% of people living with chronic pain are going without treatment that could improve their quality of life. So, Brodie Young hit the streets to find out who is in pain and how they're dealing with it.
Yes, I do have a few joints, aches and pains. I take quite a few medications.
Daily. It's a little bit of denial as I get older. I train physically, so it's a matter of trying to accept what I can no longer do that I used to do in my 20s and try not to complain about it.
You know, mood stabilisers, antidepressant type things.
Yeah, I actually have shoulder pain today.
I'm not giving out massages or anything, so
get them into wellness clinics and get this pain sorted out from a holistic level.
Hypnosis.
Hypnosis? We haven't got that yet today.
I think probably the same amount of pain as everyone else, you know, headaches, you know, like a sports injury maybe, like a bad knee, those sorts of things.
I've got a arthritis thing called psoriatic arthritis, and it's a bit debilitating, but we're in control of it at the moment.
What was your pain level?
My pain level was a 7 out of 10, and yeah, my bone popped out of my skin, so definitely.
I reckon that's more than a 7 out of 10.
That is off the charts in pain.
Full on.
Nice to have you back. That certainly shows pain doesn't discriminate, right? It can affect all of us at some stage of our lives. But we thought we'd talk a little bit more about it.
Yeah, because we've always assumed that the pain will ease once an injury has healed. But as we said earlier, for 1 in 5 Australians, the pain actually never goes away. So that is our hot topic for today.
Let's make it a big one too. Let's delve into it a little bit deeper. We're joined by Dr Roberta Chow. You're a GP, but also with a specialist area in
I have
pain.
a special interest in pain.
OK, well, you're the one to help define what chronic pain actually is then, first up.
Chronic pain is pain that lasts beyond 3 months.
Oh, right.
And it can last, once it's gone past that 3-month period, it can often go on for years and years and years. And that is truly depressing and debilitating.
What is chronic pain doing to Australia?
Well, it costs billions of dollars. I think in 2007, Access Economics did a study, and it showed that I think the total cost of taking into consideration loss of work, loss of contribution in other ways, medical costs, was $34 billion. Now, that's 11 years ago. So there hasn't been another estimate like that. So you can imagine it is in the billions of dollars.
Wow.
But that cost is also to the individual, to families. So it's the dissolution of families, it's the breakup of relationships, it's the loss of that whole normal context of living.
And Leanne, from a mental health point of view, what is the cost that you see?
Look, I think there's no question that chronic pain's related to things like depression, anxiety. So I think once you've got mental health issues that compound the issue, it can make the pain worse. And I think part of the problem is the modern perception we have of health as being the absence of illness. And unfortunately, that is still how we see health and illness. So there's this constant search to actually be well and healthy. And I think when you do have those mental health issues, it leads to a sense of helplessness because you feel further away from where you're meant to be, which is healthy. So you see disintegration of identity, relationships, as you mentioned, and that further being entrenched in just illness and unhappiness and helplessness.
So the stats were 1 in 5 Australians suffering with it. Is that the sort of amount of numbers we see coming into a pharmacy?
Yes, it
seeking
is.
relief.
Seeking relief, seeking the quick purchase, Ed, perhaps filling a prescription that's ongoing, so month after month after month. But look, in all of this, we talk across all of our time together, a lot of mental health issues. Just get connected. We do Are You OK Day and we do Lip Timber. All of these things are important because many issues are initiated by chronic pain.
I'm interested to know because I have family members who experience chronic pain, have for many years, and they've felt very unheard when they've sought help.
Yeah.
But are we perhaps too soft?
I don't know whether we're too soft. I think we're overstimulated. I think we're so focused on what's going on out there. We're on screens, we're busy, we're going from one appointment to the next, so that when something happens in our body that's unfamiliar, we don't understand it. And so I think that's why having that validation and that understanding is such a critical component to actually recovering and working through chronic pain.
Well, Gerald, you're a career pharmacist. You've spent decades dispensing, and hearing people's distress as they come to you. Can we eradicate pain altogether, do you think?
We can't, Ed, and it's a matter of essentially, and correct me if I'm wrong, but you've got to own the pain. Understand what the pain's doing to you. I'm a quality of life sort of guy, and pain certainly is the focus. But what effect is that pain having on your quality of life? Does it mean you can't go to work? That's severe. But maybe if you're a little older, we're all living older, you can't go and collect your grandkids from school. You can't go and bowl or play golf with your mates. And when that happens, your world falls apart, doesn't it? Because you lose the social contact as well.
So we're not saying that people need to just suck it up and live with the pain. There has to be something to be done.
But understand it, though.
Right.
Understand it. What's causing the pain? Because so often, as you said, we've been used to going along, buying or being prescribed a pill, popping the pill, expecting instant relief from pain. It's not that easy.
I have read that mindfulness and meditation can be really helpful in this regard.
Absolutely. I mean, that's teaching you to be in the moment. So rather than actually switching off and avoiding the pain, which doesn't work, actually sitting in it, understanding it and changing your relationship with it. So rather than reacting to it in a negative way, in an emotional way, you're actually almost looking at it as something external that you observe and have a look at the impact it's having on your life more objectively.
There is another aspect to this in terms of the longer term management and the search for a cure, the search for the magic pill. And it's very clear that a lot of these interventions, which are part of ordinary medical practice and surgical practice, back surgery and such, really don't end up in, most of the time, necessarily with a good outcome. Back surgery, for example, 30% of people are the same, 30% worse and 30% no better. But people do want to search for the cause of the pain, and that's a process probably before they get to the ability to accept it. So if I could counsel anybody in chronic pain, it would be don't keep searching. Don't just go and have another MRI, another CT scan. Sure, you'll find things, but they may have absolutely no bearing. So don't spend money, try and avoid surgery. Look for those simple things.
And Gerald, what about the use of opioids? I know that you have expressed great concern about this in the past.
It changed earlier this year, Joe, where the availability was cut right back, and that's okay. I don't really know whether, though, it's fixed the problem. The prescribing rates are still high. It's costing a lot of money. It's costing a lot of relationships and a lot of lives because not much has changed, sadly.
In what way is it costing lives? Because these are surely prescribed.
Yes, I know, but they're not effective. And there's an ever-increasing dependence on them. Doses get higher. Add that to a person living for a longer period of time. And sadly, rates of opioid deaths are rising all the time.
Leanne, any advice for families who have loved ones in their home that are possibly depressed or at least very, mood altered by the pain that they're living with?
Communicate. I think people with chronic pain stop talking after a while because it gets tiring.
People don't listen anymore.
Yeah,
another headache.
That's right. And families are very good at getting on with things and saying, oh, they haven't complained today, they must be having a good day. Not necessarily. So don't just believe what you're saying. Always assume that there's something going on underneath the surface.
Gerald, you're the last in the chain generally when people are coming for the medication or the advice. So you're part counsellor too.
Yeah, well, in many cases because they've been through these pathways that we've talked about. But I think the important thing, we all agree, it's an individual thing. It's an individual response. Own it, understand it, talk about it. The Holy Grail doesn't exist at this stage. Maybe with medicinal cannabis and other things, it might. But
I
at
don't
this
think
stage,
medicinal cannabis is going to be the Holy
might help
Grail.
though. Might help, but who knows? But
yes,
we've got to
true,
find that out.
true.
But
That's another big topic for
True,
another
that's
day.
another big balloon topic.
Dr. Roberta, thank you. Leanne, Gerald, as always, great advice.